In this video, we're going to talk about osteoarthritis and some of the common treatments for osteoarthritis. We're also going to talk about prolotherapy, what it is, its history, how it works, how well it works, number of treatments required, and any adverse effects. Osteoarthritis is a condition that is very common in Canada. It affects 1/3 of Canadians over the age of 60 years old. And this is a problem which is characterized by pain and disability. Some of the treatments used to manage osteoarthritis include acetaminophen, otherwise known as Tylenol, anti-inflammatory medications, cortisone injections, as well as hyaluronic acid injections in some cases. And in the more severe cases, more of an end-of-the-line treatment is a total joint replacement. Now let's talk about prolotherapy. I'm sure there's a reason that many of you are tuning into this video. Prolotherapy is essentially an injection of a concentrated sugar solution with a little bit of local anesthetic into the affected area. In the case of osteoarthritis, the injection is directly into the joint. This is not a new treatment. Prolotherapy was originally studied in the 1960s for back pain. And since that time, there has been a lot of studies on prolotherapy for many different conditions, everything from low back pain to ligament laxity, joint instability, and even osteoarthritis. But how does it work? Prolotherapy, by its concentrated nature, is a mild irritant. So when it is injected into a joint space, it has a mild irritating effect on the internal structures of the joint. The body sees this irritation as a micro injury. It sends blood flow, it sends growth factors to the area, and it's really thought that these growth factors are what are doing most, if not all, of the work for prolotherapy and making it as an effective treatment as it is. Another good question to ask is, does prolotherapy really help people with osteoarthritis? And to answer this question, let's take a look at the research. There have been 16 clinical trials that have specifically investigated the effectiveness of prolotherapy for managing the pain and the disability of osteoarthritis. And of these 16 studies, 15 of them found that prolotherapy was indeed quite an effective treatment, and only one of these studies found that it was not statistically significantly effective. But what are the chances that each person who's treated with prolotherapy is going to see good results? Again, let's go back to the research, and it was found that 8 out of 10 patients who were treated across those 16 studies had good results and their pain improved significantly, and they were quite satisfied with the results. Very much in keeping with the results from the research, what I've seen over the past 10 years of using prolotherapy with patients with osteoarthritis is a 80 to 85% success rate. So most patients who get the treatment, they do quite well. By and large, adverse effects are not common with prolotherapy. With that said, it is actually fairly common to see some discomfort after the treatment. Usually people who get the injection will have some tenderness and some soreness for a day or two afterwards. Of course, some people, they don't get any pain at all. To wrap up, prolotherapy is a safe and effective treatment for people with osteoarthritis. If you'd like to learn more about prolotherapy, you can take a look at the link in the description of this video. It leads you to an article written by myself about prolotherapy. It expands on some of the points that I've made, and it does go through the research more in depth. Thanks for watching.